Hello, I'm Andreas Rück. I'm a cardiologist at Karolinska University Hospital in Stockholm, Sweden. We have conducted a European registry to track the performance of a new iteration of the ACURATE Neo2 of the ACURATE valve. So this is the ACURATE Neo2, which came out in September of last year. And we have been tracking consecutive patients at 12 European major centers to check its performance. So the classic ACURATE Neo has been around for a couple of years. And as of September last year, the ACURATE Neo2 came out, where the major difference is that the sealing skirt has been enhanced by 60%. There's also an additional radiopack marker to make it easier to position it in the proper place in the annulus in the patient. We have registered 554 patients across these 12 centers in Europe. And the patients have been treated from September to last year to March of this year. And the major data that we are tracking is the rate of paravalvular leak post-operatively, also the major complications that are possible, including pacemakers, and also we will conduct analysis by core lab. So the data reported so far has been the locally reported echo outcome of the patient. What we have seen is a very low incidence of post-operative paravalvular leak. So the rate is just 1.3% of a paravalvular leak. That's more than mild, which is way lower than in the previous publications on the earlier iteration, the Neo device. And it's also on the same level as the last iterations of the other major commercially available TAVR devices. Pacemaker rate was 6%, so that's actually even lower than in some other studies on the previous generation of the device. So that's also encouraging. So we think now with the current iteration, the Neo2, we think it's at least on par with other devices currently on the market, with a comparable rate of PVL, which is really low, and the pacemaker rate is as low or maybe even lower than some other devices on the market. The next steps for us will be to complete the core lab analysis, which we will do on quantitative aortography for assessment of paravalvular leak. We will also look at the echocardiograms, and we will also assess the pre-procedural CTs for any predictors for leak in the few patients who get a leak after the procedure of this device. That data will be presented at later meetings this year.